Hello everyone. Today's video will be on obstructive shock in the continuation of shock series. So let's get started.
When something is obstructing the blood going into and out of heart or great vessels, this obstruction can quickly lead to a huge drop in the blood pressure and thus the cardiac output, causing decreased perfusion in all body organs, leading to obstructive shock. Remember, in cardiogenic shock, heart is unable to meet the body's metabolic demands due to pump failure, due to myocardial dysfunction, resulting in decreased cardiac output. However, in obstructive shock, there is also poor cardiac output, but in this, the heart muscle itself is often fine and some other process is there which impairs the heart performance. The most common causes of obstructive shock are tension pneumothorax, cardiac tamponade, constrictive pericarditis, pulmonary embolism, and hypertrophic cardiomyopathy. In this video, I will be explaining each of these causes in detail. Tension pneumothorax. It's a life-threatening condition which is caused by continuous entrance and entrapment of air into the pleural space, thereby compressing the lungs, heart, blood vessels, and other structures and forces a mediastinal shift. Patient will present with sharp chest pain, tachypnea, shortness of breath, tachycardia, low blood pressure, cyanosis, and jugular venous distension. The diagnosis of tension pneumothorax is done often by chest X-ray or CT scan, and treatment is effective pleural decompression. Another common cause, cardiac tamponade. It's a medical emergency that takes place when abnormal amounts of fluid accumulate in the pericardial sac, compressing the heart and preventing the heart's ventricles from expanding fully. The excess pressure from the fluid prevents the heart from working properly. As a result, the body does not get enough blood and it leads to shock. Symptoms in these patients are anxiety, restlessness, sharp chest pain that gets worse with deep breathing or coughing, and the classical physical findings seen in cardiac tamponade patients are the Beck's triad, which includes hypotension, jugular venous distension, and muffled heart sounds. The diagnosis is usually done by echocardiography and the treatment is pericardiocentesis or pericardiectomy. Constrictive pericarditis. It is a condition in which granulation tissue formation in the pericardium results in loss of pericardial elasticity, leading to restriction in the ventricular filling. It is usually a chronic condition, however, sometimes subacute, transient, and occult variants have been seen. The patient will present with symptoms like shortness of breath, chest pain, fatigue, dizziness, loss of muscle mass, loss of appetite, swelling in the abdomen and lower legs from fluid buildup. The diagnosis usually is done by echocardiography and the treatment is pericardiectomy. Pulmonary embolus. The most common cause of pulmonary embolism is the breaking of blood clot in the leg's deep veins known as deep vein thrombosis. Other causes are obesity, pregnancy, smoking, and patients who have undergone a major surgery. Here also the symptoms are shortness of breath on exertion, intermittent chest pain which usually worsens with breathing, a feeling of anxiety or dizziness or lightheadedness, arrhythmias, palpitation, coughing. Some patient will also experience fatigue and tachypnea. The diagnosis is usually done by CT angiography and the treatment is done by thrombolytics or embolectomy. Hypertrophic cardiomyopathy is another cause of obstructive shock. It is most commonly caused by abnormal genes in the heart muscles. These genes cause the walls of the heart chamber, especially the left ventricle, to become thicker than normal. And when these walls become thickened, they become stiff and can reduce the amount of blood taken in and pumped out to the body with each heartbeat. These patients also present with chest pain, shortness of breath, fatigue, arrhythmias, dizziness, lightheadedness, fainting, and swelling in the ankles, feet, legs, or abdomen. The treatment of hypertrophic cardiomyopathy can be done by septal myectomy, alcohol septal ablation, or heart transplant, depending on individual patient. Mavacamten, a medicine, is also approved by FDA in April 2022 to treat the obstructive form of hypertrophic cardiac myopathy in people who have symptoms. So, to summarize, obstructive shock is basically because of obstruction in the blood which is going in and out of heart or great vessels. There are certain common causes which I have explained, which include tension pneumothorax, cardiac tamponade, constrictive pericarditis, pulmonary embolism, and hypertrophic cardiomyopathy. Depending on each cause, the patients have various symptoms, and the diagnosis is done depending on each condition, evaluating via radiological means.
I hope you all understood obstructive shock well. The next long video will be on distributive shock. If you are liking my videos, do subscribe, like, share, and comment. I'm also posting MCQs in the community section of my channel. Do try to attempt them. It will definitely help all those people who are preparing for their exams.